This episode is brought to you by 9 a.m. Health. 9 a.m. Health, diabetes care that fits your life.
What's up, everybody? Welcome back to another episode of Healing in Hindsight, your no BS source for thriving with diabetes. As you, Taylor Danielle, and back for another episode of Hindsight Thoughts. And today I really want to talk about the emotional struggles, conditioning, and kind of triggers that we experience as diabetics, or at least for myself. And feel free to let me know if you've gone through this too. Now, diabetes is a chronic disease that can be challenging with all sorts of things, and it's hard enough to manage the physical stuff, but what about the emotional stuff too? And so we all know that this can be tough. And in this episode, I really just want to take the time to talk about how you can work through those emotional struggles and recognize that even though diabetes can have a huge impact on you, it still does not mean that you're not able to thrive. But in order to thrive, not only do we need to be in physical sync with ourselves, but emotional sync with ourselves. I am a firm believer that you are allowed to feel what you feel, but we got to be able to rein it in sometimes so we can keep going. Let's do it.
Perfect.
You're listening to Healing in Hindsight, your no BS source for thriving with diabetes. What's up, guys? I'm Taylor Danielle, and it's my goal to help millennial diabetics like myself live an amazing life without your diagnosis getting in the way. I get it. I was diagnosed back in 2015 with type 2 diabetes, and it was really hard to find people around my age to understand how to travel, socialize, or even have meaningful relationships. But I feel like with a focus on mindset, perspective, and nutrition, together we can take back our health and our lives. Consider this the red table talk, but for diabetics. Minus the entanglements, though. So let's do it.
So let's talk about a couple of different things before we jump into some different thoughts that I have about how to manage the emotional struggles with being a diabetic. The first thing I want to talk about is what is conditioning and how in the heck does it play a role in what our diabetes or diagnosis path is. Understand that conditioning is the process of a person teaching you how to behave or respond to an event. So you hear about societal conditioning, parental conditioning. You might have heard the term interchangeably with programming or something like that, but that's what it is. I don't know if there's anybody who played sports, but you do conditioning days, which is basically getting your body and training your body to be in a certain state so that way you can perform better in whatever sport that you're doing. It's no different with your mind and with your emotions. And so a lot of the things that we have experienced have been conditioning of how we should do, say, or react to certain things. I'll use, because I also am all about body and self-acceptance, especially for women, is we're conditioned to believe that seeing a woman nude from the top up is bad, that a woman's exposed breast is vulgar, it sometimes is sexually objectified, that it's just bad all around. You shouldn't do it. You need to be covered up. However, we're also conditioned that if a man takes off his shirt, that it's not offensive to see, it just might not be appropriate for the place that you're in. No shoes, no shirt, no service type stuff. But for a woman, it's not the same. So we're conditioned to believe and react to certain things based upon what someone else has taught us to do, whether that's consciously or subconsciously. There's definitely unconscious conditioning based on your environment, based off of how you see other people react and wanting to have this collective mindset where, okay, because other people are doing it, I should too. I used to love watching those shows where they would show social experiments of, I think my favorite one, it was a doctor's office. And there's a bunch of people in this office. And randomly at a certain time, well, I guess it's not random, but they had it set on like a timer where everybody would stand up and then sit down. And then everybody would stand up and then sit down. And it was like, I can't remember if it was like a bell or something that went off. But what would happen is that some stranger who has no clue that this experiment is going on would then join the waiting room, and they would notice everybody standing up and then sitting back down. And eventually you start to see that the person who walked in unsuspectingly starts to do the same thing because they assume that because everyone else is doing it, that's what they're supposed to do too. And it's the same thing with our emotional behaviors. Now, I'm not a psychologist. I am not certified or trained in any of these things. This is just based off of my experience, my own research, and learnings. But what I do understand is that you can train yourself to emotionally respond to things, whether you want to do it for, the good of yourself, or sometimes it can be done for your detriment. So when we think about conditioning, we have to think about what are the things that we were taught, whether we directly or indirectly, what were the things that we were taught on how we should react to certain things. The reason why I bring this up is because oftentimes with medical diagnoses, we're supposed to react to specific things as good or bad. So if you're diagnosed with, I'm trying to pick something minor, so like strep throat, it's not as common as the common cold, but it's something that you have to have treated with antibiotics, whatever. You're not exactly freaking out. You know that you got to get some medication. You're going to be at home for a minute because it's contagious, and lots of soup, lots of cuddles, lots of sleep, lots of tea, and just rest. But when it's something like cancer, our reaction to that is it's detrimental. Now, it's not to say that receiving that isn't, but the thought is, how did we know